So one of the goals of respiratory treatments or airway clearance techniques is to get more mucus out, get bacteria out, kind of help the cilia and the respiratory tract. Well, one thing to think about when you're doing these treatments is your abdominal muscles, your transverse abdominis, your internal obliques, your deep core muscles are helping with this. So these muscles are not only postural muscles, but they're also respiratory muscles. And depending on what you're doing will depend on how much energy they focus on one thing or the other. Well, think about when you do your workouts. So when you go to the gym or you start your workout at home, you usually do a warm-up before you go into kind of the harder portion of your workout. Well, think of that like your respiratory treatments as your workout. Right, you're going to spend time focusing on getting and coughing up mucus, getting all that all out. Well, what if we warmed up the muscles before you started the treatment? Now you have a potential that since it's warm, there could be better improvements on what you're trying to accomplish. So think about before your treatment, spending a couple minutes just working on breathing in a good posture position. So in through the nose and out through the mouth. Trying to get as much air in as you can. As you get the air in, try and get the pressure all the way down to your pelvis, to the bottom of that pelvis, okay, the pelvic floor, and then just exhaling through the mouth. Just nice and easy. We always like to start with the breath and then we add the posture. So think about in through the nose, as slow and controlled as you can, trying to get a 360-degree expansion, not just some chest breathing, and then exhale through the mouth, bringing the rib cage down and back. From a side view, what we like to do is thinking about here is I'm going to pull my rib cage down and be in almost a kind of straight spine position. I'm going to breathe in, letting all of this and all of this expand, and then I'm going to exhale, tucking my rib cage subtly down, and then repeating that. Once again, as I breathe in, I'm trying to put all the pressure down on my pelvic floor at the bottom of my bum, and then exhale, nice and easy. So being in this kind of straight posture position allows a good alignment of the respiratory muscles that are also the core muscles. Now you see, I did this in a seated position because some people like to be in a seated position when they're doing respiratory treatments. Now if you're doing this in different positions, breathe in those positions. Because what we talk about is no posture is a bad position. Obviously, if you're in a posture for too long, then it's going to hinder you in other ways. However, if you're doing a treatment in a certain position because that's what you like, first before, take a step back and do a couple breaths in that posture. Allow your brain and body to kind of connect and get a rhythm and frequency going, then introduce your treatment to it. Because sometimes think about in the mornings you wake up, you go right to your treatment, or you spend a couple minutes and go to treatment. Well, the body may have not woken up and remember what to do to the potential that you want. So add in just a few minutes of just breathing in a good posture position or the position at which you do your treatment, then integrate that the treatment in. And as you advance, integrating warm-up exercises that kind of loosen your body up, like mobility, flexibility exercises, will also help. But once again, always start small first. Start with some breathing in the position you want, then start to integrate and make your own mini warm-up before your respiratory treatment.